You wake up, glance at your morning newspaper, and notice the words seem to shimmer slightly in one corner. Most people dismiss this as tired eyes or needing new glasses, but that tiny visual disturbance could be your brain sending an urgent warning signal. 1 in 3 adults over 60 experiences what doctors call a silent TIA or mini stroke without any obvious symptoms. Yet a simple 1-minute vision test can detect these brain events months before a devastating major stroke occurs. If you've ever noticed even the slightest change in your vision, drop a comment below and let me know what you experienced. I'm going to show you exactly how to perform this test in the next few minutes. I'm Dr. Bill Harrison. Over my 25 years specializing in post-stroke rehabilitation, I've worked with countless seniors who've lost their ability to speak clearly, walk independently, or recognize loved ones, often because warning signs were overlooked or misinterpreted as normal aging. The vision test I'm sharing today is the same screening tool we teach neurology residents during their first week of training, and it takes just 60 seconds to complete. Here's what you'll discover in the next 10 minutes. You'll learn the exact steps for the do-it-yourself grid test that can reveal mini strokes happening in your brain right now. I'll explain 3 specific eye-brain warning signs that many optometrists unfortunately dismiss as typical age-related changes, even though they often indicate something far more serious. Plus, I'll share a simple 2-step nighttime routine that research shows can reduce your risk of retinal blood clots by nearly 40% without requiring any new medications. Before we dive in, hit that subscribe button and turn on notifications, because this channel is dedicated to giving you the medical insights that could literally save your life or the life of someone you love. If protecting your vision and your brain matters to you, please tap the like button now so YouTube knows to share this potentially life-saving information with other seniors who need to see it. Let me tell you about Robert, a 72-year-old retired electrician who came to see me last year. 6 months before his visit, Robert had started noticing that when he read, certain letters would occasionally appear wavy or slightly distorted, almost like looking through water. He mentioned it to his wife, who suggested he probably needed stronger reading glasses. Robert figured she was right and didn't think much more about it. 3 weeks later, he suffered a stroke that affected his cerebellum, leaving him struggling with balance and coordination. What Robert didn't realize was that his retina had been sending him warning signals for months. He simply didn't understand what those signals meant. If Robert's story sounds familiar, or if you know someone who's experienced similar visual changes, please share this video with them right now. Early detection truly can make the difference between prevention and devastating consequences. Most people believe that small visual distortions, missing spots, or wavy lines in their vision are just normal signs of getting older, perhaps early cataracts or those annoying floaters that seem to drift across your field of view. However, groundbreaking research published by Johns Hopkins Ophthalmology in 2024 revealed something startling. When they studied seniors complaining of unexplained visual blind spots or distortions, 48% showed evidence of silent mini-strokes on their MRI scans. These weren't dramatic, obvious strokes, but small blockages that had occurred without the person even realizing it. This research completely changed how I approach vision complaints in my practice. If this information is new to you and you're finding it valuable, please give this video a thumbs up to help others discover it too. Now let me walk you through the 60-second vision test that could potentially save your life. You'll need to find something called an Amsler grid, which is simply a square pattern of evenly spaced lines with a black dot in the center. You can easily find one online or ask your eye doctor for a printed copy. Here's exactly what to do. First, cover your left eye completely with your hand or an eye patch. Focus your gaze directly on the black dot in the center of the grid and keep staring at that dot without moving your eyes. While continuing to look at the center dot, pay attention to what's happening in your peripheral vision. Remember, bright light only for accurate results. Notice whether any of the straight lines appear wavy, bent, or distorted. Check if any squares seem to be missing or filled with gray shadows. Look for any areas that appear blurred or seem to have a donut hole effect where part of the grid simply isn't visible. After you've examined the grid thoroughly with your right eye, switch and cover your right eye instead. Repeat the exact same process with your left eye, again focusing on the center dot while observing the surrounding lines and squares. If you notice waves, missing squares, gray patches, or any kind of distortion that makes the grid look abnormal, I want you to pause this video right now, write down exactly what you observed, and schedule an appointment for what's called an eye stroke screening with either an ophthalmologist or a neurologist. If you discovered any distortions during this test, please comment the word "wave" below this video. If your grid appeared completely normal, comment "clear." You're definitely not alone, and sharing your experience might encourage others to take this test seriously. If protecting your vision and your brain matters to you, please tap the like button and subscribe now so YouTube knows to share this potentially life-saving information with other seniors who need to see it. The reason this simple test works so effectively comes down to basic anatomy. Mini strokes, or TIAs, frequently occur in the tiny branch arteries that supply blood to both your retina and the occipital lobe of your brain, which processes visual information. When these small blood vessels become blocked or damaged, the changes often show up as pattern distortions in your vision long before you experience more obvious stroke symptoms like slurred speech, arm weakness, or facial drooping. There are 3 specific morning and evening warning signs that suggest your eye-brain connection might be compromised, and I want you to start paying attention to these immediately. The first warning sign is what I call flashbulb flashes when you're waking up. These are brief, bright white bursts of light that you see even when your eyes are closed or when you're in a completely dark room. They typically last just a second or two, but they're distinctly different from the normal patterns you might see when you press on your closed eyelids. The second sign is a temporary gray curtain effect. This happens when you stand up from sitting or lying down, and suddenly part of your vision becomes shadowed or dimmed for 5 to 10 seconds before returning to normal. Many people assume this is just a blood pressure fluctuation, but it can actually indicate compromised blood flow to the visual centers of your brain. The third warning sign I call "where did the words go?" This occurs when you're reading, and suddenly 1 or 2 lines of text seem to have gaps or missing words, even though you know the text is complete. You might find yourself rereading the same sentence because parts of it seem to disappear and reappear. If you've experienced any of these 3 warning signs, let me know in the comments below by typing "flash," "curtain," or "words." Your experience could help other viewers recognize their own symptoms. If you've noticed any 2 of these warning signs within the past week, your retina and brain are trying to communicate something important to you. Don't ignore these whispers. Schedule vascular imaging with a healthcare provider who specializes in stroke prevention. Now, I want to share a simple 2-step daily habit that recent research shows can dramatically protect both your retinal and brain blood flow. Step 1 involves what I call a bedtime omega-3 boost. Take 1,500 milligrams of combined DHA and EPA with your dinner each evening. For those following a vegetarian diet, algae-based DHA supplements provide the same brain protective benefits. A landmark study published in Harvard's 2025 Nutrients and Neuroprotection Research showed that this specific dosage reduced retinal microclots by 39% after just 90 days of consistent use. The timing matters because taking omega-3s with food improves absorption, and evening timing allows the nutrients to work while your body repairs itself during sleep. Step 2 is a 1-minute breathing technique I call 4-2-6 nasal breathing, performed right before you go to sleep. Inhale slowly through your nose for a count of 4. Hold that breath for a count of 2. Then exhale completely through your nose for a count of 6. Repeat this pattern for just 1 minute. Research has demonstrated that this specific breathing rhythm increases your nighttime nitric oxide production by 18%. Nitric oxide is the same compound that keeps the tiny arteries in your eyes and brain smooth and flexible, reducing the likelihood of dangerous clots forming while you sleep. If you're planning to try this breathing technique tonight, drop a comment saying "breathing" so I know this information is reaching people who will actually use it. And if you haven't subscribed yet, please do so now, because I share these evidence-based health strategies every week. There's one common mistake I see people make when they try to assess their vision, and it can lead to missing important warning signs. Many people check their vision in dim lighting, particularly in bathrooms with yellow or warm-toned bulbs. Poor lighting makes it impossible for your brain to distinguish between true visual distortions and shadows created by inadequate illumination. Always perform vision checks in bright, even lighting, preferably natural daylight or under a bright white lamp. If your grid test reveals distortions and you suddenly notice facial drooping, it's time to act immediately by calling 911. Remember the acronym BEFAST for stroke recognition. B stands for balance problems, E for eye changes, F for facial drooping, A for arm weakness, S for speech difficulties, and T for time, because every minute counts when someone is having a stroke. Please share this BEFAST information with your family members right now. Send them this video, because knowing these signs could help them save your life, or you could save theirs. Let me recap the key points so you can start protecting yourself today. Perform the Cover One Eye Grid test monthly, carefully noting any waves, missing areas, or distortions. Begin the 2-step nighttime habit of omega-3 supplementation with dinner and 4-2-6 breathing before sleep. Comment "Grid clear" below if your test was normal, or "wave" if you noticed any distortions. Please share this video with anyone you know who wears reading glasses, because their eyes might literally save their brain. If this video has opened your eyes to the connection between vision and stroke risk, please give it a thumbs up and subscribe for more life-saving health information. Your engagement helps YouTube show this content to other people who desperately need this knowledge. Next week, I'm going to reveal the $12 kitchen flashlight technique that emergency room doctors use to assess brain swelling in just 3 seconds. This is information that could help you recognize a medical emergency before paramedics even arrive. Make sure to subscribe so you don't miss this potentially life-saving technique. This content is for educational purposes only. Always consult with an eye care professional or vascular specialist for personalized medical advice regarding your specific situation.